Welcome to 10 Questions with NBC 10 Boston. Today's guest is a man that wears many hats, Jon Santiago, currently a representative here in Massachusetts, as well as an ER doctor. And as you mentioned, you worked in the Army as well. Thank you for joining me.
Thank you for the invitation. I'm so happy to be here.
First of all, my first question is, do you ever sleep? After reading your resume, I was exhausted.
I do. The answer is yes, but
Okay.
I will say that my wife is actually a sleep scientist, so I'm kind of her guinea pig. So I get a number of hours in, but there's a lot of work to do at the hospital and the State House, and obviously in City Hall. So I think it's important that we're out there with the community, and that's why I've been blessed with a lot of energy.
That's amazing. But as I mentioned, you were on the front lines of this pandemic. How was the past year? How has the last year been for you?
It's been a very challenging year. Obviously we've had a pandemic that has upended everything that we know, whether it's our schools, our economy, everyday life. But this was also an opportunity to step up and lead. And in this year, I actually doubled my hours in the emergency room, because I was healthy, I was young, and I wanted to be in the fight. But it was also a year where I stepped up in the state legislature. The Speaker of the House asked me to serve on his COVID leadership team, a group of 5 members that really led the House in the COVID response. So challenging year, no doubt, but this is what leadership is about, stepping up in moments of crisis. And we did that, and I'm just glad that we are the place in the Commonwealth where vaccinations are up and businesses are open and folks are starting to go outside.
How do you think your experience in the ER could translate into a mayoral seat?
Well, what's the experience in the emergency department is very similar to what happens on the campaign trail or in government. I mean, the idea that as an ER physician, you have 2 to 3 minutes to engage someone, to listen to them. I often tell my medical students and residents, you have 2 ears and 1 mouth, and you should be using that, right? The famous American physician once said, listen to the patient, they will give you the diagnosis. And that's my approach to campaigning and also to governing as well. We need to put the smartest people, the people that are on the ground, on the front lines, at the table, centering their voices. And my job is really to facilitate that. And so my work as a community organizer, as a former Peace Corps volunteer, as a captain in the Army, it's all really about centering the voices of the people most impacted.
This is on your website for those who want to read, but just quickly, how did you get inspired to work in a field like medicine from the beginning?
Yeah, for me, it's always really been about what I call the social determinants of health. Understanding that why people show up at Boston Medical Center in the emergency department, it's directly related to what's happening or what's not happening in their communities, right? It is ultimately the poverty, the lack of educational, economic opportunity that will result in something medical. And then I'll see them in the emergency department. So we have to get at those root causes. And for me personally, it was the tragic death of my uncle. He was infected with HIV. He died of AIDS at the age of 36. And, he was a good man, but he was poor. He couldn't access good health care, and he passed away. And that struck a nerve with me. And I decided to give back and commit my life to public service. It would take me all around the world, serving people in Latin America and Africa. And then about 10 years ago, I decided to come back to Boston, to home, to address all the issues that I wanted to address abroad. And so I've been fortunate and blessed to have gone to medical school and have been at Boston Medical Center for the past 6-7 years, working the overnight shift in the emergency department. And those experiences in there with those patients really gave me an awesome insight into what's going on in the city of Boston, and it's what inspired me to run for office in the first place.
In the area known as Mass and Cass in Boston is a prime example of what you mentioned, the poverty, the drug use that is clearly so blatant in our city. What do you think the mayor of Boston should be doing with that area of Boston?
The mayor has a very important role to play. I mean, right there, as you said, it's a nexus of homelessness, substance use, and mental health issues, right? But what's happened there, because of the concentration of services, is there's also a number of people preying on vulnerable residents. There's a lot of violence going there. I'll work Friday, Saturday night in the ED this weekend, and I guarantee you I will take care of people who've been assaulted, people who overdosed in that area. So I think a number of things have to happen, and I've been very vocal about this as a resident of the area who lives 1 block from Mass Ave, as a physician who works at the epicenter, and as a state representative. Right now we need to put a moratorium on services there until we figure out what's going on. But we need to do 3 main things. We need to decentralize services. We need to regionalize services, because many of the folks are not from Boston. So we have to come up with a regional response, and we have to modernize services. The idea that we can, still have shelters with 500 plus people in the era of COVID-19. We have to move away from that. And I propose moving to a more modern type of housing solution where we have permanent housing with wraparound services to get people the services they need, because people are suffering down there, not just from homelessness or mental health or substance use, from those three issues. And so we have to address each and every one of them. But you're going to need a mayor who's committed to addressing it, who understands it, and who lives it. And I'm that person.
Do you think that plan is sustainable?
I do. And that's what I put forward. I mean, I never envisioned myself as an elected official. I only got involved in politics because my community, wasn't getting the representation that they deserved, because my patients weren't getting their needs taken care of. And that's why I ran for office. And my goal in running for office, and my hope to be when I'm the mayor of Boston, is really to elevate the voices and amplify the concerns of my residents, my neighbors, and my patients. And that's what I've done at the State House for the past couple of years, and that's what I'm doing on this campaign trail. And should I be the next mayor of Boston?
And as you mentioned, you are also from the Boston area. You grew up here. What was your experience like growing up here in Boston?
So I was born in Puerto Rico. We moved to Boston when I was, in the 80s. I was a young person. We moved here in search of opportunity. My father wanted to graduate college, and no one in my family had. And he went to school full-time at Northeastern. He worked during the day full-time. My mother took ESL classes at UMass Boston. So for me, although we were living in Section 8 housing in Roxbury in a very turbulent period in the late 80s, early 90s, Boston has always been a place of opportunity where if you work hard, if you dream big, good things will happen. But it's also been a place of tragedy. Growing up in a tough neighborhood, watching my uncle, become infected, and seeing the disparity in care and in wealth in the city of Boston that is still here today. It's important that these challenges remain. I mean, in the district that I represent as a state representative, from Copley Square to Nubian Square, there's a 30-year life expectancy difference. This is Boston, Massachusetts. We can and we should do better. And I'm committed to making sure we do that.
One thing you also mentioned is that you are still actually a captain in the U.S. Army Reserve. How did that come about?
So my family, a Puerto Rican family, family that is proud to serve in the military. My grandpa was a veteran. My uncles served as well. And I've been honored to serve in the reserve for the past 7-8 years. And I recently came back from a deployment from Kuwait in the midst of the first and second COVID surge. And, the Army experience, it's about sacrifice, it's about service, it's about duty, it's about honor. And, what I love about the Army is that you're working with people all across this country, whether you're black, white, male, woman, what have you, and coming up with problems to address complex solutions. And I think that's what I've done my entire life as a crisis leader in the emergency room, where if I don't get things done, I put people's lives at risk. As a captain in the Army, where if you don't accomplish a mission, you put your soldiers' lives at risk as well. That's what the city of Boston needs right now. They need a crisis leader. They need someone who can go in there and get things done, and that's what I'm committed to doing.
When you aren't wearing your many hats, how do you decompress? What are your mental health de-stressing methods?
These are very important.
Yeah.
Without a doubt, you have to de-stress. So I like to go for jogs in the morning to decompress. I like to read. I like to go out to eat with my wife. We make sure that we have a date night every once in a while. My favorite restaurant is down the street from me, and so we go there. But there's so much at stake here with this election, and that we need someone who's 110% committed to stepping up, showing up, and being present to address the most pivotal issues in our time.
What is that favorite restaurant?
Well, it's Mita. My wife has been in there every week for the past 15 months or so since it opened up, and we live just a block away, so we go quite often.
Chef Douglas has been on this series as well, so you two have that in common.
You're a good man, great cook.
And you mentioned your Puerto Rican descent. You are of Puerto Rican descent.
Mm-hmm.
It's still a part of the U.S. People fail to realize that. But what is something about Puerto Rican culture that you wish more people knew?
Just how open and happy the people are. I think, obviously some of the Puerto Rican community here in Massachusetts is challenging, right? The mainland has been through the wrecking ball, hurricane, economic devastation, you name it, right? But these people are incredibly resilient. They are good people. They work hard. And I'm just so honored and blessed to represent the community. In addition to me being Puerto Rican, I happen to represent parts of the South End of Victoria, and it's an incredibly resilient community that has stood for so much, a proud one. And I'm just very proud to be Puerto Rican, to come from a family that has embrace the culture. And I'm just proud to be a Latino man in Boston doing, people's work.
And to that point, Boston is a very diverse city, but we've seen the Boston Globe highlighted, or I guess it's a low light really, the wealth disparity here in this city. How does one fix that reasonably?
Well, I think we have to understand where we're coming from. There are a lot of structural issues that resulted in that, right? And this is no surprise. The wealth gap, which is related to the health gap, which is related to transportation justice, climate justice, you name it, right? I mean, the poorest communities in Boston are beset by a whole host of challenges, and they often have to be communities of color. And so I think for me, back to my work as an ER doctor, as a state rep, and as a captain in the Army, it's about empowering those communities, right? When I was organizing communities in the Dominican Republic as a Peace Corps volunteer, it's about working with them hand in hand, letting them know that they can, have agency and they can change their own lives, and really giving them the power and the resources to do that. And I think that's the same thing that we got to do in Boston, and I'm committed to doing as an ex-mayor, to empower, to strengthen, and to work alongside, communities that have been, downtrodden, that have been most vulnerable. Because listen, there is no lack of intellectual intelligence, there is no lack of resourcefulness, capability in some of these, Black and brown communities that I come from. It's a lack of opportunity. If you give them an opportunity, they will succeed. I've been very blessed in my life that I've had one or two opportunities come my way that allowed me to step up and lead and become a physician, become a captain in the Army, get elected to the state house, right? But there are thousands and thousands of young people of color who are every bit as smart, as capable, but we need to give them the opportunity to do that.
How do you open the doors for those opportunities and convince them that those opportunities are worth it?
Well, I think you have to invest in them. As mayor, I'm going to be on the streets with them, working with them, letting them know that they can be anything they want to be. And I'm committed to making sure that, whether that's in the schools, whether that's working with their parents, whether that's making them feel like they have, that they're invited to City Hall, that they can access City Hall, that they, are part of democracy. When I ran the first time, I knocked on 9,000 doors when I ran for state representative. And listen, I wasn't just knocking on doors to ask for someone's vote. I was asking them to take part in democracy, take part in changing their community, their society, and their future. And they responded. And so my job as the mayor of Boston is really to facilitate that, to create agency and to empower people.
And as I mentioned already, you are from here. What makes you so proud to be a Bostonian?
Just the resilience of the city, and I think it was spotlighted during COVID-19. We had a very challenging time on the front lines. I remember going to my shifts and every day early on in the first surge coming up with a new plan based on the science, based on the concerns, based on the PPE. And it was a very chilling experience, but we stepped up as a community, as a healthcare system. And I was very proud to be a part of that, and not just taking care of patients on the front lines and doubling my hours, but also in the State House, and look, we're at a place right now where infections are on the decline, vaccinations are up, and I'm very proud of what we did. Listen, was it all perfect? No, it was tough, it was challenging, but in the very American way, we stepped up, we worked together, and we were at our best in terms of challenging and overcoming one of the most difficult times in our city's history.
Finally, there are so many diverse, qualified candidates for this mayoral election. What makes you stand out the most?
Well, I'm honored to be part of this diverse historical, election. What makes me different is I've committed my life to public service and to getting things done. I never envisioned myself as an elected official, taking the next step to do something, to have another title. My life is really a bit about serving those most vulnerable. Whether that's in the Army, whether that's in the Peace Corps, whether that's in the ER, and having results. Managing crisis teams and getting the job done. And that's what the city of Boston needs right now. We have a crisis when it comes to the affordable housing issue. We have a crisis when it comes to the schools. We have a crisis when it comes to the polarization of the city. I'm dead set on making sure that this city can come back together stronger than ever, and I'm going to provide the leadership to do just that.
Jon Santiago, thank you not only for your service to this country, but your service during this pandemic. I wish you the best during this election.
Thank you for having me.